Hi everyone, and thank you for listening to my talk on the key approaches to improve Arctic health. When reflecting on this semester's content, I decided to pick 3 very specific improvements that I believe can change Arctic health. Here are my top 3 strategies. Number 1, to increase the available resources for mental health and suicide services. Number 2, to enhance current substance abuse programs by making them more culturally sensitive and available. And number 3, to increase preventative health services for Indigenous peoples. For my number 1 strategy on mental health and suicides, here are the people who I believe can implement these strategies. Suicide rates continue to rise in Arctic countries, especially among the Alaska Native, Canadian Inuit, and Greenlander populations. A phenomenon known as suicide clustering is especially concerning for adolescent suicides. Clustering is when adolescent suicides tend to occur in epidemics within a set time period in the same district. For those who live in the Anchorage area, just in this past semester, 3 adolescent suicide has been recorded in the Eagle River and Chugiak communities. This would be an example of a suicide cluster. Suicide attempts in the Arctic communities are just as concerning, and professional help should be made available for those who have attempted and contemplated suicide. Many Indigenous people do not have access to mental health services or refuse to seek them out. Many resources for mental health services should be implemented and made readily available for all Indigenous people. Multi-component programs such as the SAMI Psychiatric Youth Team should be emphasized in these areas. This program utilized Norwegian municipalities, psychologists, social workers, and medical doctors who all had Indigenous ancestry or Sami culture. Adolescents were able to admit themselves into this program and receive extensive use of SMS text messaging services both for their appointments and for their interventions. This tech-savvy program appeals to adolescents to join the program and has been proven successful in intervention cases and reducing the dropout rate when people join the program. This program was multi-level, modern, and innovative, and programs like this should be replicated and implemented for Indigenous groups that may lack adequate healthcare facilities. Another strategy is to increase the amount of telehealth counseling sessions made available in remote villages. For my second key concept, I'm talking about enhancing the current substance abuse plans. Alcohol, tobacco, and illegal drugs continue to plague many Arctic countries. Alcoholism can affect violence, unintentional injuries, mental health, and suicides. Clinicians, nurses, and any healthcare provider working with Indigenous people should be trained and ready to recognize childhood trauma in their patients. Resources should be available and plentiful in every village, including remote locations. The Alaska Department of Health and Social Services estimates that almost 175 Alaskan villages have absolutely no mental health service other than an occasional provider. Every effort should be put into providing these villages with Alaska Native licensed professional counselors. Pam Dieters, a professor at the University of Alaska Fairbanks, reported that part of the problem is having non-native behavioral health providers in the villages. They usually are not around for long and they can't accustom to rural Alaskan life. Programs at the University of Alaska Anchorage, such as the Alaska Native Community Advancement Psychology, should be further developed in efforts to recruit Alaska Native behavioral specialists. Talking circles have also been recently proven to be effective in primary care to address a wide variety of health issues, including mental health and substance abuse. Talking circles are much like any Alcoholics Anonymous, Narcotics Anonymous, or Sexaholics Anonymous programs, where addicts can gather to gain accountability and understand where their addiction has stemmed from. Talking circles provide a safe place where people are able to share their feelings without being judged, criticized, or looked down upon. Public health professionals should instate talking circles in each village where depression and substance abuse are high. This type of therapy has been proven effective in primary care and is culturally sensitive to Alaska Native peoples and other indigenous peoples in the Arctic. Elders and community health aides would be excellent candidates to initiate and sustain these programs. Author Harold Napoleon stresses the importance of talking circles and inner healing in his book, Yuyurok, The Way of the Human Being. He goes on to explain that the establishment of the talking circle, specifically for members of the village who have addictions, is crucial. Like the circle for the village in general, the circle would help the alcoholics to better understand why they became addicted, and with the help of other recovering addicts, get on the road to recovery and health. This circle should come elders, parents, friends who love them, to hear them, see them, to reassure them, to receive them. A quote from Harold Napoleon himself. And lastly, my third key strategy is to increase preventative health services for Indigenous peoples. Most healthcare dollars in the Arctic are spent on curative services rather than preventative services. In Greenland, only 1.5% of healthcare dollars are spent on preventative services. Vaccinations, prenatal care, and education for adolescents, including substance abuse and risky sexual behavior, should all increase in rural Indigenous peoples. In order to increase the number of children between the ages of 19 months and 34 months who receive all of their vaccinations, public health officials need to offer community parenting seminars explaining the evidence and potential risks for vaccinations. In remote villages, the community health worker could perform these seminars. Physicians should also include this message during prenatal care, allowing the parents ample time to make an informed decision. When parents are educated about risk reduction rather than health-enhancing benefits of vaccination, they will more likely consider vaccinating their children. To increase the number of women who attend prenatal care sessions, education and resources for both adolescents and young mothers on sexual health, pregnancy, and infant care needs to be available in every community and village outside of a medical setting. Many mothers are not attending prenatal care due to long distances of medical clinics or distrust for any physicians or medical personnel. Public health educators need to offer adolescent and parenting health classes in non-traditional sites. Examples may include in churches, wellness community centers, schools, or Head Start programs. This would ensure women of childbearing age would have adequate education about sexual health, pregnancy, infant, and child care. And lastly, for education for adolescents. Health educators, I believe, should go back to the basics and begin educating parents and adolescents together on sexual health and substance abuse. A study was conducted in Texas to assess whether an interactive program including a parent-adolescent dyad would increase communication within the household and reduce risky sexual behaviors, and it did so. These interactive programs were held after school, on school campuses, with professionally trained counselors and health educators. It is crucial for public health educators to include parents in sex education in early adolescenthood to prevent risky sexual behaviors. If you haven't already witnessed by now, a recurring theme in all three of my strategies is to increase the availability of different health services in remote Arctic locations. I believe that the collaborative work between municipality public health workers, village physicians, nurses, community health aides, and tribal elders can increase the amount of mental health, substance abuse, and preventative services that are available in remote Arctic villages. I recently heard at a tobacco control conference a speaker who pondered on what it would be like if his village didn't have alcohol, tobacco, fry bread, prescription opioid abuse, cancer, and premature death were not the normal of his life. He once considered these things tradition, and that they were a part of life of being a Native American or Alaska Native. He soon realized that none of these things were traditional aspects of the village, and that generational healing needed to occur if any of these disparities were to disappear. I wonder what the Arctic will look like when mental illness, substance abuse, and preventable diseases are no longer part of Native tradition. Thank you for listening, and I appreciate your time in all discussions we've had this semester. Thanks.